the notion is that you can kind of align the economics with the medicine, and people will start to get the kinds of care that they need. I'm going to skip ahead here. So this integration is underway, and there are these partnerships, public-public and public-private and private-public. Glad there aren't any more iterations than that. I wouldn't be able to fit any more little ovals on my screen. But there are efforts this way, to move this way. In the midst of all of these efforts, in the last 15 years or so, all of this is going on. Things are being carved out and carved in, and changes are being made in policy. But there are some problems, because there isn't really legislation that allows for some of this integration. It doesn't allow the money to follow the service. And so there's been a movement, mental health parity movement, about 16 years ago or so. It probably started 15 or 16 years ago. And this movement was toward parity in benefits coverage. And there has been a fair amount of activity, a little bit of activity. Back in 1992, Pete Domenici proposed the first parity bill. That was in '92. Not much happened with that bill until 1996. The Mental Health Parity Act was passed, and that was seen as a real victory. And what that particular Parity Act said was, you can't have different annual limits and lifetime limits between medical and mental. So it didn't deal with copays or deductibles or out-of-pocket costs. It just dealt with limits. And that was seen as a real victory that time. Even though it didn't change everything, it did change something. And so I think the proponents of parity felt like they were on their way. And there were lots of victory celebrations after that was passed in '96. President Clinton signed in June 1999 legislation that would have all of the federal health plans, all the health plans that were available to federal employees had to have mental health parity. So that was a move. So there was something like 6.8 million people who were covered under plans that had mental health parity, not in its most pure form, but at least had parity. In July of 2008, of last year, Congress changed some of the rules on Medicare to say that we're going to decrease the copay on visits for counseling or mental health services to have it be equivalent to the copay under Part B for medical services. So it dropped from a 50% copay to a 20% copay, which is the same as the medical benefits under Medicare. Now, one problem with this was that this is phased in over 5 years, so starting in 2009. So it's going to take a little while to get from 50% to 20% for Medicare recipients. And then, of course, the big celebration happened last October, 2008, when the Emergency Economic Stabilization Act was passed. One very small piece, and I'll show you how small a piece it was in just a second, was the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act. Something happened after that I don't want to forget, and that's because even though we're beyond 2008, but a couple of months ago when the S-chip was reauthorized, it was also reauthorized with mental health parity in it for children. So I don't think it got as much attention as I think some of us would have liked, but that particular piece was a very striking change to that legislation and a real step forward. So the Economic Stabilization Act, just to give you an idea of kind of where this came in. These are the parts of the act. The Economic Stabilization Act is really large. You know, academics write a lot of stuff, but we don't write anything that large. And so you have a Division A, which was the economic, the stabilization, and this is the toxic assets part of it. And then you had a huge section, this Division B, that dealt with energy tax credits and improving facilities for energy. And then Division 3, which were tax extenders and alternative minimum tax relief. And so it's under there, on subsection B, that the Paul Wellstone and Pete Domenici Mental Health Parity Act came. So you may not have been in favor of $700 billion going toward toxic assets, but if you're pro mental health parity, there was a little bit to celebrate when that passed in 2008. And so this was the actually the ceremonial signing in November when President Bush signed the Mental Health Parity and Addiction Equity Act. And you'll see President Bush and Pete Domenici from New Mexico, and Edward Kennedy and Patrick Kennedy and Jim Rapstead, Republican representative from Minnesota, who all had worked very hard for a number of years in trying to get this legislation passed. What this legislation did, even though it's only 11 pages out of these 300-page piece of legislation, was it had to amend 3 acts. It had to amend ERISA, the act that allows large employers to self-fund their own insurance plans and therefore be exempt from state mandates, insurance mandates. It had to change the Public Health Service Act, because the Public Health Service Act is the act that that regulates employers who are completely insured through benefit plans, through insurers, and then the Internal Revenue Code, and that's because employee tax benefits employee health benefits have different tax implications, both to employer and to the employee. And so this 11-page act is actually really only 3 pages because it's just duplicated for each of these acts. So within this 3-page piece of legislation, there are lots of details. Well, first of all, the Mental Health Parity Act is to actually come into effect, actually be implemented 1 year from the date that it was passed, which was October 3rd, 2008. And so it should be implemented starting on October 4th, 2009, or in the benefits year that immediately follows that. So perhaps for the state, your benefit year is from January to January, in which case the mental health parity regulations would need to be in place by your January benefits year. So it's coming up pretty soon. The other piece of the note in this, however, is that it needs to be started in 1 year, or the nearest year after October 3rd. But there needed to be regulations written by that time as well. But you know, even if there aren't any regulations, you still have to implement it. And that's really specific in the Act. So there may be maybe a time period when we're moving toward mental health parity in our kind of insurance policies and health policies, when we're doing that without any regulations. So regardless, the Act only affects employers with more than 50 employees. It doesn't affect the individual market, individual insurance market, or your individual policies. And so if there is a group health plan that already offers mental health benefits, then it has to implement parity. So it doesn't force employers to offer mental health, but if they do, then the parity rules apply. There's several bits and pieces of language in this law that are still somewhat nebulous, and we're hoping for some help from the regulations in trying to interpret them. Some seem clear until you think about how you're going to actually implement them. One of them is that the law says that treatment limitations should be no more restrictive than the predominant treatment limitations applied to substantially all of the medical and surgical benefits. So we have no more restrictive and substantially all that we need to understand exactly what it means. So that's treatment limitations. And the financial requirements, the law says that the financial requirements have to be no more restrictive than for medical and surgical benefits. But they need to be no more restrictive than the predominant financial requirements to substantially all of the medical. So with financial requirements, we're talking about copays and deductibles, out-of-pocket costs, coinsurance.